Hello friends, are you confused as to which toothbrush to use, which toothpaste to use, when to start brushing for your kids, stop the night feeding, if they're swallowing up some toothpaste, what to do, if they're not ready to brush, what to do? So in this video, I've tried to cover up all these points such that it will help you to set a good oral care routine for your child. This is Dr. Virani from TRISA Dental Solutions, Mumbai. Now, it is very important to take care of the oral cavity and the gums even before the teeth erupt. So take a piece of thin cotton cloth or a piece of gauze bought from the chemist, wrap it around your finger and dip it in a bowl of water. Massage it all over the gums and even the tongue for 2 to 3 times. Continue using this technique till their first few teeth erupt. Or you can also use finger brushes which are made up of silicone and have bristles on them. You're supposed to wear that on your finger and brush their teeth. Once they're 9 months to 12 months, you can switch over to a narrow head toothbrush available with all the chemists. Some toothbrush are really small but bulky and round. Do not take that. Take the ones which are small and narrow. You can check out the design of the toothbrush available with the company named Pigeon. The toothpaste of choice till the time they do not know how to rinse and gargle is a non-fluoridated toothpaste in a very small, minute quantity, the size of that of ice flake. Chico, Pigeon, Mama Earth, even Himalaya company has a lot of non-fluoridated toothpaste. Here I want to highlight about feeding, especially night feeding. Whether it's breastfeeding or it is bottle feeding, it must stop after the age of 1 year. Now, if that is taking some time, one tip is that every time your child has milk in the middle of the night, you need to give him some sips of warm water after that so that there is no layer of milk remaining onto the tooth surface for the entire night. Next is by the age of 2 years, you need to teach a child how to spit out and gargle. Best to do this is not during brushing. At later time of the day, when the kid is in a good mood, take a glass of filtered water for both of you. Make it a fun activity and you can keep rinsing and spitting out and showing him how to do it. Eventually, he will learn it. Once your child is well versed with rinsing and gargling on his own, you can switch over to a fluoridated toothpaste by around the age of 2.5 to 3 years, like Cheerio, Kidodent, as fluoride is very important for the health of your teeth. The quantity should be as minimal that of a pea size. Lot of kids love licking the toothpaste and taking it in. For such kids, it's best to use the toothpaste only once a day, and the second time when you're brushing, only use the toothbrush and brush away all the food particles that are there onto the tooth surface, and then give them some sips of warm water which they can either rinse or even gulp down. If you use more toothpaste than the recommended quantity and fill the entire length of your toothbrush with the paste, and if your child makes it a regular habit of ingesting it, then definitely he can have certain gastric issues and stomach problems. There are some kids who do not like brushing. So what you can do is take them along to the stores to choose their own toothpaste and the fancy toothbrushes which are available. There are a lot of electronic toothbrushes which are available. They have some music, they have timers. So involve them in decision making. Maybe that will help. Now, once your child has picked up his favorite toothbrush and toothpaste and you're ready to teach him how to brush on his own by the age of 3 or even earlier, for the first 1 year, it has to be done under the supervision of an adult. In my next video, I'm going to talk about the brushing techniques. Till then, if you have any other queries, do get in touch with us. Thank you.
Like a bird on a tree.